You need to understand that if you're looking to build a global business, that health economies around the world are different, how reimbursement works around the different is different, even medical practice around the world is quite different. So if you're trying to build something that's going to be scalable, you need to think about how am I going to build it in a way that is going to be highly configurable, and how am I going to build it in a way that it can scale across those different challenges of different therapies, different territories, etc. It's not just about technology, it's about psychology, about understanding patient behavior, it's about understanding the clinical context as well. Human beings, of course, are complex individuals, and every patient is different, and every patient experience is different. So the challenge of understanding that context and providing services that are really appropriate to those patients is I think, the challenge that we face. If I was a provider and I was looking for a vendor, I'd be looking for a team that was had a multidisciplinary capability. I'd be looking for a team that had a track record of understanding patients and designing patient services, and I'd be looking for a team that or a vendor who understood the regulatory environment, because the reality is that does place certain constraints on what's possible. And for example, a lot of the services that may be developed, they may involve introducing devices that will be classified as medical devices, and it's very important that that's clearly understood by the vendor, and that they have the capabilities and the infrastructure to be able to deliver those services. They need to engage and have an ability to engage with all parts of the healthcare industry. In particular, obviously, they need to have an ability to understand patients. We need to engage clinicians so that they can influence. We need to engage pharma companies in believing that they can engage and that they should invest in providing services for patients, and not just services around their own medication, but maybe broader services to support patients. And we need to invest time with payers as well, so that they can understand the benefits that can accrue from this engagement. So it's a kind of a multi-stakeholder engagement. The last thing you want is a bunch of technologists in a room deciding that, we understand this about a patient, now let's send them this information or give them this kind of support, because really technologists aren't going to be able to figure out what's going to work best with patients. So it needs to very much, they need to embrace the idea that healthcare is complex. It requires a broader understanding of multiple disciplines.